Well, thank you for having me here. And I've tried to resist pretending I'm on the round table when certain good questions were asked. Um, Here's why I said yes to come. I'm not going to talk about these very much. I'm going to go through them really pretty quickly. Um, but a point was made, I think, by Lori on the last panel about the changing complexion of who's in our schools. So have a look at that. Anywhere where you see red, low-income students are already a majority of who's in school. The states we worry about the most are the ones that are persistently in poverty, extremely high poverty. That's what Lori was talking about, 200% of the poverty level. We're talking about $10, $12, $15 a day. Given that reality, here's what we know and see about the likelihood that any of these kids will move out of poverty. These pretty much speak for themselves. Not too surprisingly, the lowest graduation rates, forget college completion, the lowest high school graduation rates are in this same geography. And finally, notice that those are the folks we spend the least amount of money on. So that's what's going on in the country. I'm going to be faster than our allotted time, I think. We were asked, I think, to sort of talk about growing examples of collaboration and interaction. I'm simply going to offer categories of that. There are any number of examples of health and wellness indicators being now or recently incorporated into school report cards. So I call that a focus on indicators and metrics. There's a fair amount of activity going on with screenings and fitness assessments and things like that. Call that a focus on service integration or co-location. Handful of examples of system interaction, thinking about parts of Louisiana where folks have actually asked for waivers to Medicare so that they could carve out resources to pay for school-based health services. I'd actually argue that as I listened to Lori talk just a little bit ago, that the opportunities for system interaction and collaboration are somewhat more prevalent in the early learning space. Those systems characterized by mixed markets, less barnacles on the system, so a little easier to maneuver, and to some degree, because there haven't been as many resources in that system, more incentives and interest in trying to figure stuff out than in the next level up. But what we don't see enough of are the efforts to think systemically. That's hard to sustain when there's no reliable funding stream. And when we're talking about a K-12 system that has just getting used to thinking in terms of evidence-based interventions and the like. So, we've got some maturation to do on the education side in those respects. But there's lots to do. We could do a better job of preparing teachers to promote health and wellness. We could arm schools and school districts with strategies. We can do more with the getting more data into these integrated systems, but I would argue there are some bandwidth problems there. Much of the attention on data systems in K-12 is on the alignment of administrative records, i.e. data about teachers and other adults, and student records. But the focus and attention of that work is largely on trying to generate pressure for results, accountability. It's not for decision-making and continuous improvement. So it's a very different, motivation. If we did want to move toward the kinds of things, and I agree that Lowell was kind of suggesting, here's 3 or 4 specific examples. I would call them low-hanging fruit till you get to the last one. First would be just to take a look at our existing state Medicare plans with an eye toward how they might be tuned to adapt to the opportunities and challenges of paying for services in school districts. Second, might be a good idea if we thought about, back to this earlier point, healthcare plans and strategies for LEAs that were linked to their own goals for academic success. I couldn't agree with you more. Why conflict, on the goals? Third, imagine our having an electronic student health record or some way to track data at the level of the student that was merged with the existing student record that has the data about attendance and performance and the like. In the end, it would be really interesting to see some experiments or tests or demonstrations with coordinated care networks that would give us an opportunity to rationalize how things would work in time and space. Today, there are few incentives for that, so I think your frame is an interesting one to test. I was intrigued with Phyllis Meadows' 3 questions, so I'm going to repeat them and speak in a certain way to each one. First thing she asked was, what can we do this time around to craft more sustainable policies? On the education side of that, at least, what I'd argue, Phyllis, is that we could think harder about integrated supports for students and families. We could think harder about personalized learning plans and a number of things like that, neither of which is part of the dominant reform narrative in education in this country right now. We've talked a lot about the Common Core, but that emphasis on the Common Core has not been contextualized. What's that really about? And I won't say as much about that now as I could, but suffice it to say that at the very least we have a kind of unit of analysis challenge. Most of the policy attention right now is in moving away from system-level solutions and moving toward large numbers of small schools. Think about, I'm on an NRC panel right now trying to evaluate the reform efforts right here in the District of Columbia, a city that now has almost half of its kids and nearly half of its schools are charter schools. So without getting into a debate about, what you get from that, the reality is that we're spawning relatively little innovation, which is one of the motivations for forming these charters, but lots of inefficiency and competition at a time in a system where the can't afford either of those things. So imagine talking about integrating systems when in this city, for instance, the system is a collection of LEAs spread all over the place. Hard to fathom how you do that in an efficient way. Second question Phyllis asked, are there policies we need to sunset? I would say that we need a more interesting dependent variable than a standardized test score on the education side. That if we could focus on the whole child, that would open up to all the things you'd need to take into consideration in order to get the learning outcomes that we are really interested in. Third question that Phyllis asked, are there policies we need to sunset? Wow. Here I think our own attempt at the federal level, at the state level, and at the local level to pick on very specific problems to solve has led us to design what? Categorical initiatives, which by their very nature create the silos and discrete funding streams and unique accountability structures that work against the strategic collaboration interaction that we frequently wish we had more of. So, there's quite a bit that we could re-examine if we had a better frame. If we had a better frame. But there is also a problem with narrative. And this is a little more on the context on the education side. If you looked back at that slide I showed you with per pupil expenditures, if you listened to the presentation at lunchtime and then the first panel after lunch, I could argue that there's been a systematic disinvestment in public education in this country as we have known it. Part of that has to do with this shift in paradigm from school systems to loosely coupled systems of schools. But it's very difficult to argue, for educators to argue that they can take on more when in a political environment where reformers and political leaders alike aren't so sure the system can get anything right in the first place. So this takes me to David's question. There are, I think, you said, should we just get out of the way? No, I think that's the last thing that should happen. I would say your points 2 and 3 need serious consideration. There are too few voices prepared to argue that systems can produce better outcomes just by holding their teachers accountable, publicly embarrassing the adults when the test scores don't go up. Accountability is not a capacity building strategy for the schools, to make a long story short. But the disparities and gaps in incomes are real. And the correlations between those gaps and health and wellness are real too. So I would argue if there was ever a moment when a sector, relatively more known for using evidence as a basis for deciding, a long history of trials. Now, listen, I read the news, and there are some rather confusing debates coming out of the health community too. But it's odd that when those bones of contention surface, they don't end up undermining the core integrity or basis of the system, like what's going on with our public education system at the moment. So if there was ever an opportunity, a leadership moment for folks outside the education system to underscore how important it is for that system to actually work, and then offer a range of ideas about how to generate better outcomes, David, I would say now is that time. Now is that time. Because these folks are under a lot of pressure to generate marginal gains in rather uninteresting measures. Right? In rather uninteresting measures. And our current data and assessment systems are largely focused, I think a point I made earlier, on just trying to detect whether or not anything's happening, and not on generating data that would help anybody improve the system. The testing window opens up in April and it closes at the middle of May. The data from that system show up in August. The kids I've moved on, and little of that data, little of these data would be useful for making a set of judgments about how to improve teaching and learning in any event. They're at too high a level of aggregation. So, and finally, our new assessment systems, if you're in the Delta, if you're in Little Rock, if you're in Birmingham, if you're in Appalachia, they don't have enough bandwidth to even execute the new Common Core assessments designed to measure. They'd have to turn everything off just to try to administer one of these tests. So the idea that they've got time in resources to attach to or integrate to the electronic records, forget that. My wife is a pediatrician. She's been waiting for me to get into these health issues for quite some time. So I'm taking my foundation into those issues. But I would just simply leave with you the thought that the round table needs to drill more deeply into ideas and strategies that might give rise to broad-scale systemic change. Those of us in philanthropy are much better at creating these pilots, generating these existence proofs, and testing the efficacy of things. We're wholly unsophisticated at promoting systemic change, and we need a lot more discourse about how to pull that off. Hence, I think the importance of both Phyllis's and David's questions. Thank you again for having me.
Thank you, Kent. So next, Terry Wright is going to speak to us, and she's the director for the Center for School Health and Education at the American Public Health Association.